Hi, my name's Rachel. I am a senior graduating in public health with CU Denver, and I recently did an internship with the International Rescue Committee as a health education intern, which was a really awesome experience, and I really recommend everyone to do an internship. I think it's a really beneficial experience. I was a health education intern, and so basically I meet with all of the incoming clients, and we work with refugees, asylees, and special immigrant visa recipients. And so I would meet with all the families and go through a health education class. It helps them kind of to guide them to the health resources, navigate the health system in the U.S., such as insurance and co-pays, pharmacy, all of that. So we cover just basically all the basic health information they need, supply them with like a health folder that has all that information and has information about like interpretation, letting them know their medical rights, all of that. And so it's really cool. I get to meet with basically all of the incoming people into our organization. The highlight for me was just feeling like I am actually helping people, and even in a small way, just being a small part of a bigger organization. And a good example is I was able to connect a family with WIC benefits who had kind of fallen through the cracks. They missed the registration call, and they wouldn't have known otherwise about WIC and the benefits for their children. And so just something as small as that made a huge difference, I'm sure, for that family. And so it felt really impactful to just be in a position where I could do that and help people. I think just having a strong foundation and knowledge of the health system and how it works in the U.S. For my health policy class, I used that a lot, and then also for my global health class, learning about cultural competency, having respect for different cultures, and just having a better understanding of different determinants of health around the world and how that affects the population of clients that I'm working with. Has been really beneficial, and also I was able to, for my final research paper, use some of the data about the effectiveness of the program and use that to kind of talk about the effectiveness of the program, and we talk about that in public health a lot, like analyzing the effectiveness of different programs and preventative health, which this would fall under. Definitely pursue an internship. It's a really invaluable experience, and I would also say that be creative and think out of the box. At first I thought I could only find like a governmental public health department position, but there's so many areas of public health, and you can really be creative and find different organizations other than like the obvious ones that you would originally think of, because there's so many opportunities out there. You just have to find it and take that time and do that, but it's so worth it when you do. I went to the Experiential Learning Center when I was when I had found my internship and I wanted to kind of set it up, and the advisors were really helpful. It was a really easy process to get it started. So yeah, it's been a great experience. I definitely recommend going to the Experiential Learning Center, even if you don't have an internship set up, just to even talk about the possibilities of one. They're there to help. So.